more extreme cases, people may act out, they may strike out at somebody, or verbally assault somebody when actually their anger is more toward themselves. But I think if we try to help people focus on the cognitive, what's going on in your head, and then also take a look at those kind of body cues, like, not having energy, changing your habit. If you were somebody that was a three time a week gym goer and you cut back to 1 day or cut back to nothing, something's not right. You're just not feeling very good about yourself. So the cognitive as well as the behavioral stuff are some cues to look for that you're not feeling good about something or about yourself.
Mhm. And the physical and mental are so intertwined. I think
Right.
it's easy to forget that. So that as people get busy, if they're working, going to school, having a problem, having
Mhm.
relationship problems or whatever, all this wears on you. So when you find yourself, not getting enough rest,
Mhm.
not as Sydney said, not doing things you usually do like exercise,
Mhm.
not eating the way you usually do, it almost as though you open yourself up for worse damage in terms
Mhm.
of mental health and mood. Depression is something that we do have drugs for that can be helpful.
Right.
But again, it's a question of um, taking care of, first of all, your physical self.
Mhm.
So when people are feeling stressed out, they really do need to make sure they're getting enough rest, that they're eating healthy, that they're not staying by themselves. This is hard to do if you're working 2 or 3 jobs, for example,
Mhm.
but that
Mhm.
you're not isolating yourself from your friends. If you enjoy going to church, you need to keep that up. If you enjoy a game, a basketball game once a week that you usually go to at the gym, you need to keep that up because
Mhm.
that kind of thing helps the promotion and prevention that Dr. Robertson is talking about.
Mhm.
Mhm.
I definitely understand what you're saying. Like it might seem silly how the physical, what I'm about to explain, how the physical and mental intertwine. Both my daughters, 20 and 22, recently had boyfriends, and the stress of that, I think I developed an ulcer. You know what I'm saying? So sometimes, no, seriously, like
I bet. Yeah.
the stress of knowing what they're dealing with, I developed an ulcer.
Yeah. Yeah.
So sometimes I take medication. But Doc, you keep mentioning this thing. You keep mentioning pharmaceutical drugs. In our community, we really don't like pharmaceutical drugs. Are there like alternatives we can do? Now, I'm not gonna get into drinking and marijuana, even though marijuana is legal and it's known to help with depression and other things. But are there some like foods or other things we could get into? Because when you start mentioning an alternative to mental health issues and then taking some type of prescription narcotic, a lot of people don't want to do that. We avoid that.
I understand that, and so that's why I said first you need to have a relationship with a mental health professional that you can
Mhm.
communicate with and that you trust. That's the first thing.
Mhm.
And
Mhm.
secondly, I'm not saying that that should be your first go-to thing. I'm just pointing out, in case people don't realize it, that with major depression, for example, where people
Mhm.
are at risk for suicide, etc., we now have drugs that are very effective. But you shouldn't just do drugs by themselves. So I want to make that distinction. You should at least be aware. It's one thing to make a decision, I'm not going to do that. But I don't want people to get so depressed and continue spiraling down if they're unaware of different options that are open to them. So,
Mhm.
so I'm not suggesting that pharmaceutical intervention is the major thing people should do. You should just be
Mhm.
aware of what options you have. It's just like surgery or anything else. You need to be
Mhm.
aware of the options
Mhm.
you have that may give you some relief. But I do think that just as normal human beings and certainly as family members, there are many things we could do before we get to pharmaceuticals, and we've been
Mhm.
talking about some of
Mhm.
them: the
Mhm.
rest, the
Mhm.
communication, the human
Mhm.
contact.
Right.
So that becomes and then for someone like you, Mr. Murray, that is stressed out because you have young women in your family functioning in a normal, natural way. You have to back up and have some perspective on that, and
Yeah.
support their ability to make
Mhm.
rational, mature decisions. You don't want to give them some stress just because you're having stress. So.
And Marcus, you mentioned PB or Project Brotherhood. I mean, I think that was one of the key things about Project Brotherhood that made it so special. That to bring brothers together who oftentimes didn't talk to each other, didn't talk to anybody else at all, and then just the range. I mean, it wasn't just coming to see a doctor or a nurse practitioner. We had the barber, we had folks from DCFS about getting custody of your kids back. Just really trying to address the whole scope of issues in someone's life. We did GED, help people get their GED or move on to other higher education. And that's often not addressed in a healthcare setting. I mean, I think we really were innovative, in terms of all the aspects of someone's life. And over Marcus has already dated me, my 30 plus years of being in healthcare, it's been this push and pull between physical health and mental health when the two had to be integrated. I mean, we talk about the biopsychosocial approach. We talk about all these different terms. And now the big term now is social determinants of health. I mean, COVID has certainly exposed, what we knew all the time, that people are sick because they're poor, they're sick because of where they live, they're sick because of their educational level. All those things impact your health. And I think men particularly have it difficult, that because we were educated and socialized that we should fix our own problems. Right. And as you know, and Dr. Murray knows, typically we see men in a crisis, they may have been to the emergency room, then get referred back to see a primary care physician, because their blood pressure's up or something along that line. If we could interrupt that earlier, I think we could save more lives and help people live more healthy lives.
One of the things Tonya said, and please elaborate on this if you've seen this, is that education and prevention piece. Like when you all were just talking, I'm thinking, have I ever seen a culturally specific flyer, something on social media that talked about the symptoms and some options you could do if you're feeling depressed? I've never really seen those. And, I think that needs to be out there more.
And then with some examples of showing some of the signs and symptoms that we may have, as a people, because it's definitely different. And then even in the research, it shows, I see it a lot, like they say, we don't have, African Americans don't have, like our ACEs scores are not high, and we don't have trauma. We don't have a lot of depression. And even with caregiving for dementia caregivers, they said that their stress is not as high as Caucasians. But I really believe it's because of the way the questions were worded. Because as a people, I take care of my dad who's 85 with dementia. And I'm not going to say I'm stressed out or this is so hard for me and I don't have the resources or the programs that a lot of other groups may have. I'm doing it, and we do it as a people because this is our parents. They took care of us and we're going to take care of them. So we feel like that's our duty. So the way it's scored, I've written down, they write it in the literature. So it shows that we don't have as much stress when we actually have more, but we're just dealing with it because we look at it differently.
Absolutely. I mean, that's so key. And during this COVID time when initially everything was shut down, I mean, churches and bars and everything. I mean, those outlets that people use to congregate, to be with people, to have casual conversations, or maybe to sit and just, play a game of cards with somebody or something. All those things were just not available. And so I think we're going to see, I think that's why we're seeing so much depression that may lead to suicide or other acts that are going to be harmful to yourself and to the community, because we're just now in the last, 6 to 8 months able to congregate again. But even now with this new variant, I hope we don't go back to shutdowns, but it certainly will make coming together a challenge.
Mm-hmm. And then, like Dr. Murray mentioned, going to your doctor, finding one that you can trust. But then I even developed 10 tips on how to make your doctor's visit a success, not to just go there and nod your head, yes, sir, doctor, to the next visit, but take somebody with you, ask questions, because just like people get the white coat syndrome, when you go, you're afraid. And so you might not think of the things that you normally want to ask. And then know too, if your doctor is not answering your questions, are doing what you think they should do for you, you don't have to stay with them. And then it's always good to have a friend or somebody to talk to you, but you have to be careful about that, because sometimes you talk to people and you'll wish you had kept it to yourself. So you just have to be really, careful.
One thing that I see is the change, and what really disturbs me when we look at what's going on is the increase.
Mm-hmm.
I want to talk about suicide, but obviously that's only one symptom of depression and of mental instability, but the increase in our young people. So I think for those of us that are older, whether you're a grandparent or a parent, I think we have to be very careful and understand that this is a different historical time than when we were coming up, and that generations have, they function in a different kind of context. I try to be on Twitter and stuff, but I don't really know what's going on with all this social media and the stress people have. And I think there's a tendency to underestimate the impact on people. And so I think people have to be very sensitive to what's going on and also move to protect our kids. So, for example, we're in a worldwide pandemic. And so the notion that schools should be treating students like it's normal times. Of course, I think schools are too abusive to begin with, mentally abusive. That's a different story. But the notion that we should just have these kids in high school or college and grade them the same way and have the same kind of expectations, to me, is absurd. So we have an obligation to be vigilant, to support. Look at what's happened with our athletes, where Simone Biles pulled out of the Olympics. The tennis star, said, I'm not doing this press anymore. I think that we should take a leadership from those young people and say, we're about the business of trying to destroy the world. We got tornadoes in December, and you don't have to be a genius. If I was 20 years old, I'd be scared out of my brain when I look at what's going on. And so I think that as older Black generations, we have to understand that this is a new day, and it's not necessarily better. We had hoped it was going to be better, but I'm not convinced it is better. And so that means we have an obligation to come together. I think the demonstrations after George Floyd's murder, I think that helped the mental health of a lot of Black people.
Yeah.
The fact that they were able to see those demonstrations in the street, and the fact that they participated in those demonstrations, I think that's an important part of our mental health.
You guys have been mentioning stuff about how research is conducted and things that we should do. Let me ask you this: when you, and specifically for Black folks, when you throw in racism, and I'm not giving white folks all the credit for racism, because there's some non-whites that are prejudiced, they're just not racist in the power, but they help perpetuate that whole thing. How can we function in America in a racist society without being stressed, without having those mental challenges? You know what I'm saying? Especially like what you were talking about, Doc, when you talk about school. If we look at adults that are working, we still have to work. We still have to do the same things during this pandemic. And on top of that, deal with the racism. So what can Black folks do specifically to help counter that, and maintain a sense of stability by working?
I'm going to quote Brother Baldwin. I'm looking at this because I have this right on my right. It's right out of the camera shot. It's right here every day. So let me quote this because it's important. To be a Negro, Brother Baldwin's old like me. So to be a Negro in this country and to be relatively conscious is to be in a rage almost all of the time. So that the first problem is how to control the rage so it won't destroy you. That's one of my favorite quotes from James Baldwin. And I think what this means is that the more we understand the history of racism and the more we understand how the system works to try to destroy us, and the more we can see similarities between racism against us, what happens when they lynch Mexican Americans, what happens when they try to commit genocide on Native Americans, the more we understand those connections and the more we fight for our basic rights, to me, that's one of the best things we can do as a community in terms of helping our mental health. And so people have to be able to be enraged and understand that that's a normal reaction. And we just have to fight always using whatever weapons we can to fight for us to be treated like human beings.
Yeah. See, that sounds good, but if I get enraged, they call the police on me. So Tanya, give me 1 second, Tanya, before you say something. Okay. Let me get more specific with Linda and Sydney.
Okay.
Without going into personal details, and you all are very humble, which is cool. You all have had astonishing careers in the healthcare field. Neither one of you are white. One's a black man, one's a black woman. How were you all able to maneuver and keep your soul and your integrity? Like, what tips do you have for young health professionals like Tanya and myself and the people watching? Like, what did you all do? I know, Dr. Murray, tell people, Sydney, like, those are the tips we need to figure out. Like, did you all have protectors? Did you all meet? I mean, and I don't mean physically, did you take the hit and turn the other cheek? Like, how did you all survive? Because you all grew up where you all saw the colored and white only water fountains. You know what I'm saying? So give us some tips like that, because people throw out cliches, but they don't really give us experience, tips, or stories about how to deal with it.
Well, I mean, one thing I just wanted to say, all stress is not bad. I mean, if it wasn't for some level of stress, I don't think I would be where I am, or any person who has some level of competence or success. You use that stress to turn. First, you have to acknowledge it, and then you got to admit that it's there, and then use it to your benefit to motivate you to achieve something. So I think stress has gotten such a bad label that we think all stress is bad. My parents had stress, their parents had stress. We as a people have overcome and survived in stressful situations. And I always kept that in mind, that the stress that I'm under is nothing like the stress that my great grandmother, my great grandfather, or my grandparents, or that they were under. I mean, I had more physical comfort than they had, but they had the mental stress of being called out of their name, of being disrespected, of not being able to get jobs they knew they were qualified for. So I always kept it in the back of my mind that I'm here because of all the stressors and maltreatment that they had to suffer through. So that's one thing. I think we have to kind of relabel stress. And when I used to do one-to-one type treatment, that's one thing we work on, is how can you take that stress and turn it into a motivator to help push you out of that bed, help push you to that job interview, help push you to go to school. And other thing that you kind of alluded to, Marcus, is definitely support. I mean, I went to a small Midwestern college. At the most, we had, I think, 50 Black students at the most. And then that number went down, so it went way down when it came time for graduation. But we were tight. We were very collegial. We typed each other's papers. We read together. We shared books because everybody couldn't afford books, so we had to get our books. But just that sense of community that we were able to bring, and we were great society kids. I mean, we came out of that. Lyndon Johnson, white man, poured all this money in our communities, and that allowed a lot of programs that really got us in an upward bound, other types of programs. So I think the infusion of dollars and programs went away. Now, Biden's better. I'm not sure if it's going to replace any of that stuff, but that also is something we need an investment. We need an investment in our communities that will trickle down to an investment in people, and we've lost that investment in people.
Mm-hmm. Yeah, I agree with what Sydney's saying. You if you think you're here by yourself, then you might as well give up. But we're not here by ourselves, and we're we stand on the shoulders of our ancestors. That has real meaning to me. We have to stay in communication with people who are alive and with us in the moment, but understanding where we come from is important. And for me, trying to make things better for future generations is just as important. So it's hard. When I graduated from medical school, these numbers might be off a little bit, but I can say them. When I graduated from medical school and finished my internship at Cook County Hospital, there were maybe 550, something like that, Black men who started medical school the year that I finished my internship. When I retired from Cook County in 2014, there were fewer Black men in medical school when I retired than when I started as a young physician. That is very upsetting and very depressing. And to me, the only thing that keeps me going is the insistence that we need to work together and try to get more people to have these opportunities, because we need everybody. We need architects, we need lawyers, we need everyone to function and survive. And we need these young people to fight for the planet. Climate change is real and with us, and people have to have enough strength to look to a different future and imagine a different world. It is possible to have a different world. That to me is the key thing. Think about it. If you were a slave, do you believe it's possible for you and your children to be free? If you don't believe it's possible, then they've won already. But if you believe that it's possible to build a better and different world, that's to me where you get a lot of energy and a lot of strength.
I don't know, Dr. Robinson, what you think?
I just wanted to tell Dr. Murray that I have a quote too by Nelson Mandela. I never lose. I either win or learn. So I've probably not been, well, I know I haven't been through what you've been through, but it's been a lot, and it was with people that you thought were going to be on your side, and even our own people. So it's hard to, in order to not just knock myself down and feel like I'm a failure and just get back up. And if at first you don't succeed, try again. So you just have to keep having that push in you and go for what you know is right and what you want to do.
I also want to mention too, sometimes when you were talking about suicide, I define suicide different now. I talk about self-inflicted suicide, and I talk about a suicide mentality. When I look back to my youth and some of my peers, we never talked about self-inflicted suicide, but we put ourselves in suicidal situations by either being knuckleheads, being reactionary, not understanding how to critically think and avoid situations. So I just want to throw that out there too, because a lot of times young people, they say, I'm never gonna commit suicide. Well, if you're walking around the streets with guns, gang banging and hanging out in certain situations, chances are something's gonna happen to you. So that needs to be addressed too. So let me throw this out here from what I've been hearing from everybody. I've been hearing we need an investment, like resources, financial in the community. We need to stand on each other's shoulders, learn from each other, like some mentorship. And we need to make the world a better place for our future generations. As Black folks, I'm asking all three of you all, are there any entities, and when I say entities, I'm talking about a physical establishment as well as programs. So I'm not saying just programs. Are there any entities that cater to Black folks that will allow these health professionals and Blacks to do more research, conduct more research created by us for us to help all the things you're saying? Because if we expect to go to foundations and organizations that aren't ran by us, our priority is not going to be that focused. So do you all know of any places in this country, just in the U.S., that specializes in mentoring health professionals, creating pipeline programs for young people, not just for healthcare, even architects, lawyers that talk about research in the way that's designed specifically for us? Are there any places like this that exist?
Go ahead, Sydney.
I think we have organizations, and we have Divine Nine, we have, established early.
Sydney, you're breaking up a little bit, so.
I think call out these organizations that exist. We have organizations that are here in not really doing what needs to be done right now. They're kind of living on their past successes, focusing on small segment of our community, really taking a broad approach. To answer your question, I don't know. I mean, we've had Black research tanks in the past. We've had the professional Black lawyers, Black in the beginning was to nurture young talent and to back in and pull. I don't know if they're living up to that standard anymore. I don't know how they got away from that. I think we have to change the existing groups because there's just what I've been familiar with say that they want to, they're here to work towards the betterment of the community and can pull people along. I see evidence of that right now. I don't know if it's creating organizations or getting the existing organizations to better they're going to do it in the first place.
So that broke up a lot for me. I don't know how it was for you all, but I think I actually understood everything he said, and I agree with him. I think he was saying that some of the historical institutions of our community, first of all, are objectively weaker. That is to say, they're smaller percentages of people. Whether you're talking about the fraternities, HBCUs, whatever. This is what happens when you have structural racism that undermines these institutions, the church, especially the HBCUs, since we're talking so much about research and education. And even though I agree with Sydney that they are not the way they used to be, they are still in many ways all we have. And so I think it's important that whether we are alumni, I'm not an alumni of HBCU, but it's critical that I support HBCUs and that I support and encourage the fraternities and the fraternal organizations to step up. I'm certainly not a church person, but I support churches that are trying to really tend to the needs of the community. And I think what has to happen in addition to that and trying to rebuild some of that strength is we also have to insist. I understand what you were saying, Marcus, about being careful. We have to fight for our resources that we have a right to. We have to fight to be able to control our resources. What does that mean? We have to fight for our share of what the government is supposed to be doing, which it doesn't do for any Americans enough of. So it's a struggle. It's an up and down struggle. We've been in worse situations before, and we've been in better situations before. We had a whole civil rights movement before the King era. And so we've seen this play before. And it just means working and organizing together, coming together, and trying to, we don't all have to agree. We don't all have to go in the same direction. But we do have to make sure that we're still trying to have the infrastructure that we need to help our people. And so that infrastructure is barbers and beauty shops and churches and professionals. That's what makes the infrastructure of a community. And so that's what we have to fight to preserve.
All that sounds good. Let me be more specific. In terms of what we do in our field, somebody like TONYA, Dr. Roberson, she does amazing things. I won't go into details. We'll talk about what she did with the Black college students around mental health. There's other people like Dr. Roberson that do good work for our community. Unfortunately, to me, and this is no diss to her, who she works for, a lot of times the brightest in our community get snatched up, and they have to work for people that don't look like them. They have to work for entities that don't really support our community. How come we don't have an entity that could pay Dr. Roberson the right amount of salary where she could continue her much needed research? Because we said earlier, the research that we use they might use in Guatemala and they think it's going to work in Inglewood and South Shore. We should be, in 2021, we have enough financial resources with Black America to build an entity that will support Dr. Roberson in doing her work. And while she's there, she could serve as a mentor for other young Black and other young little Negroes to get in the healthcare field, to get in any type of field. Why don't we have something like that? Was that ever a thought, like from the 60s or 70s? Or, you know, I know this is not a new concept. What happened? What's going on?
It's not a new concept. I think that I think we should be very careful in terms of. I don't want us to fall into the practice of just saying we don't support our own. That's why we're oppressed. I think we underestimate how many resources are really needed here. To really do what you just suggested. I'm not against trying to do it. The HBCUs again are one location. If you're talking about research, they have major financial trouble. It's not an accident that they do. They've been underfunded again for 100 years. This is not. We are not going to solve these problems with just small businesses. I look at the small.
Wait, hold on, Don. I don't mean to interrupt you. I'm not talking about a small business here. So just, and I'm gonna pick on you and Sydney for this one. What I'm talking about is powerful people like you two and your peers creating, let's say, a family type of project brotherhood that fosters to healthcare professionals. And from there, hundreds of programs could be trickled out. Like, have you all ever thought of that? Because I'm just not, now mind you, I'm repeating what I heard. Like, a lot of these concepts that we're talking about, or these solutions, can only really come from us. HBCUs aren't the one. Some of these predominantly white institutions aren't going to come up with programs. They don't have people like you all in positions of power to develop curriculums, to hire more Blacks, to conduct the research. Like, research dictates policy and all the things that are going on in terms of the power struggle and everything. Why don't we just create an entity on our own? Like, Sydney, Doc, Tanya, you know what I'm saying? Like, Tanya and I, and this is mental health too. We have health professionals on here. The struggle that we go through having to deal with people that don't look like us and fight for our people, it gets frustrating. Sometimes I say, the hell with it, man. I'm done. They won. I'm tired of fighting these uncivilized, let me watch my mouth, so, and I'm not saying that you have to come with a solution, but have there been any talks in you all circles throughout your 30-year histories and working? Like, was this concept just gone?
No, that was talked about for decades.
Oh, yeah. Oh, yeah.
So I can't hear you, Sydney.
Something's wrong with your earphones or something. I don't know what. You're on mute now, so maybe you can fiddle with them. But
I'm just asking the question. I'm not trying to put you two like you two are the solution for Black America. But what I'm just trying to ask is, being powerful people, like, it's about legacy. What legacy are you all leaving to teach us so we can pass it on? Like, I'm picking on you because you're my mother. You can handle it, and you'll tell me to shut up if you need to. But Tanya, help me out, man. Help me out here.
Yeah, I'm waiting for the answer too. No, I'm just playing. I don't know. I thought the HBCUs was a good start, and it can't be just one place or one group. It'll have to be like a lot of options, and maybe people from the HBCU or the barbers and the beauticians, and just come up with like a coalition maybe to work with, Black people and be mentors and things of that nature. Because I thought that the HBCUs were a very good community partner because they were in the place for you to do work with Black people. And those students, they even recognized the fact that I had culturally tailored the survey for them. They said that they could tell someone sat down and took time out to really learn about them and not just ask them about sex and drugs. And then especially the piece on mental health, which is not normally talked about. So something like that, it may not be any in existence, or some that say that they are, but maybe that might be something that needs to be put together.
Yeah, I was going to say earlier, just it's about sustainability. There's certainly the whole concept that Bobby had when he created his, Black-oriented community mental health center on the West Side was Black folks working with Black folks, and that we knew what was needed in our community. We knew the community, we knew ourselves, we knew who the patients were. And there have been other examples of that. I mean, but the issue of sustainability, I mean, one thing my mother said over and over again, that integration was the worst thing that ever happened to Black folks. That, before integration, we had to rely upon each other. Black doctors lived next door to drug addicts because they couldn't live anywhere else. So everybody we all lived together, we all thrived. When integration came, people that could leave the community left the community. And somehow we have to get back to that feeling that we are one. And until we get that oneness, it's going to be hard to do what you're just describing, Marcus, because we have organizations, we have attempts at doing this, but for various reasons they were not sustained. When the city closed 6 community mental health centers, most in our community, there was not the outcry that I thought would have been there from the so-called Black leaders. There was not the outcry that we thought would have been there.
Half of them are on the tape, but you made a good point. And just to sum it up, specifically what I'm saying, like, there has to be a way we could duplicate those Bobby Wright programs with private funding, though. Do you think we should develop a plan? I'm not saying us. Do you think if a plan was developed, some of the Black folks that were fiscally able to do it might fund that? Is it something in healthcare and those programs like the Bobby Wright program? Is it something we need to take a more business approach and think of investments to fund these programs? So there has to be something we do, because Sydney said it right. People aren't going to give us the money to sustain these programs. So we have to think of creative ways as a community to invest back in ourselves.
Exactly.
That's a real challenge, because if we look at the institutions that we do have in our community and how they've had trouble being sustainable, even when they're very successful. Right. I was just reviewing the state of the day. Little Xavier College in New Orleans has produced more, that's an undergraduate college, has produced more people, sent more Black people to medical school than any other institution in the country, than the big public institutions, than big Howard, period. So they clearly have a program that works, but they struggle every day just to be sustainable. So I think
how many alumni give back?
I don't know, but I will say this. I will say this. Don't assume that if the alumni gave till it hurt, that's enough to sustain. So we have to get alumni to give, but what we need is far more than that. I would recommend to you, Brother Darity. Dr. Darity is one of our economists, and he's writing a lot about reparations. That's why we really need a reparations program, because we're literally talking about billions and billions of dollars. But I don't want to sound discouraging, because I think you're right that we have to fight wherever we are, whether we're working for the man like in the Cook County system, or whether we're working in other educational institutions, or whether we're working in a small university, even if it's Black controlled. We have to fight to try to do the best we can and to raise as much money as we can and to be as sustainable as we can. But please don't underestimate the amount of resources and investment that we're talking about. We're talking about billions of dollars over many years. And that's why it's so hard. It's not, I don't want people, we're not a stupid people or a selfish people. We don't have, we have sellouts, but we don't have no more sellouts than anybody else has. And so
we're starting to act like fearful people, though.
Fear is a real problem when you have people that are controlling your life
accountable.
Yeah,
like a lot of the solutions. I know we're talking about mental health because that's where it starts. Mentally, if you're not right physically, nothing else is going to matter. A lot of the stuff comes from us, though. We talked about programs that work, and the key things where it was people that look like us addressing our needs and taking that community village approach, you know.
Mhm.
I don't know, man. Sometimes I'm optimistic, and then sometimes I get frustrated, man. It's and that's the thing, and
Yeah.
that's my mental health going on.
Well,
Go ahead,
yeah.
Sid.
No, and that should be your motivator to keep on going and to keep challenging us and keep challenging other people, because people. I mean, I was just approached by a major healthcare insurer that wants to collect some data on social determinants of health. I mean, we know what it is, you know, but they're willing to put some money behind, you know, an FQHC to collect this data. And, you know, I'm trying to work with the folks that I work with. And there's some trepidation. Well, you know, is this research? Are we going to benefit from it? You know, we don't want to be subject and submit our patients to all this surveying. We're not getting anything. I mean, valid questions. But here, a major insurer is saying, we'll give you X number of dollars if you collect this data for the next year. And on some level, it's very tempting. On another level, we've been burned by research when it comes from institutions. And without the buy-in. I'm sorry, Dr. Robertson.
I'm sorry. Yeah, and in the community, they're really tired. When we come with surveys, they're always like, another survey. You keep getting all this information, but then what? Like my mother says, a lot of problems, but what are the solutions? So they already knew it, and they knew it before this pandemic, but now they're trying to act like they're just so surprised now. But all this pandemic did was magnify everything that was already going on.
Absolutely.
So maybe this might be a start. Maybe they want to do something now.
We should have made this 90 minutes. We're running out of time. Man, we should have made this longer. We're going to have a part 2. So let me say this. We usually go around and let you all close out with your final thoughts. And we definitely reach back out to you for a part 2, because we need to add some more things and just talk, and it's just having fun. So this time I'm going to switch it, Sydney. I'm going to let the ladies go first. Dr. Roberson, you want to add anything, closing remarks?
Just to say that this was a very good topic, and it is a lot of work that needs to be done. And I'm here willing and ready and able to do whatever. I'm just going to keep doing what I've been doing and even more, because I believe that education is the key.
Once again, thanks for having me be a part of this discussion. It's really been very enlightening and motivating, Marcus. Even the stress you're putting on me is motivating. But you know, it's been interesting for me looking at things go in a circle, and we're revisiting issues and concepts and things that we visited 10 years ago, 20 years ago, 30 years ago. And we do have to find some concrete solutions. We really do. But I think part of that is to acknowledge that there is a infrastructure that works against us, that we have to be very knowledgeable about and challenge that infrastructure. Otherwise, we're going to keep spinning our wheels and not really go much further. And hopefully discussions like this will help move us beyond that.
Well, let me just, I'm going to quote my great-grandmother. When I was a little girl, my great-grandmother told me, Linda, the white man is always going to knock you down. And the only thing you have to decide in life is how often you stand back up. And so that's where we are, brothers and sisters. You know, we don't have what we need, but we have no choice. If we care about our children and our grandchildren, we have no choice but to try to stand up every day and keep fighting. So I want to make sure everybody has a nice holiday season, whatever holiday you celebrate. Keep your family close, and please get vaccinated and boosted. We got new variants coming out. This pandemic is not over yet, so please protect yourself and your family.
That's right.
Why would you bring that up again? You know what I'm saying? So let me say this. I know we talked about many things, but it all wraps around mental health. Google breathing techniques, Google meditation, and Google mindfulness. Be aware. If you're going to get a booster shot, be aware. Know what you're putting in your body. You're probably going to have to get another one in 3 months because they're going to come out with more variants. Enjoy the holidays. Have fun, and we'll see you the third Thursday in 2022. And like always, we want to send a special shout out and say thanks to my man, Intellectual Dre. Thanks, Dre. See y'all next year.